Hi guys, so when your pet comes in for a dental cleaning, the first thing that we usually do is when we bring them to the back, the doctor does a really good once over, does an exam from head to toe, make sure that the heart sounds good before we give any type of medication. Once everything gives the okay to go, we go ahead and we give a sedative to kind of take the edge off. We call it their pre-flight cocktail. To kind of keep them calm in the cage and also help place an IV catheter. So when we go to induce the patient, it gives us IV access for any type of emergency drugs or anything that we need to give, as well as fluids throughout the whole procedure. Okay, so the first thing that we do when your pet comes in and we do the actual dental is we take full mouth dental x-rays. So that just consists of placing a plate in the mouth and putting your x-ray over top, getting proper angles. You take the x-ray and then it should pop up on the computer. And on the dental x-ray, it shows all of the abnormalities that can happen with the teeth as well as the healthy teeth. So as you see there, he is missing one of his upper incisors, but everything else looks good on that x-ray. The whole time that we have the pet under anesthesia, there is always a technician that is with the other technician doing the dental, that is taking vital signs, monitoring, making sure fluids are running, and alerting the doctor if there are any issues while they are under anesthesia. She will also give the medications that are required as anti-inflammatories and antibiotics while they're under. The next step in the process for the dental is doing a thorough prophy, which is also known as a cleaning. So that is taking the ultrasonic cleaner, which is this machine in my hand, and getting all of that plaque tartar buildup off of the teeth, which is all of this yellow stuff that you see that's coming off. The next step after the prophy is we are going to go in and we are going to measure with this tool if there are any pockets underneath of the gum line against the tooth. So we go around each tooth and we take little measurements to make sure that we don't hit any pockets and that there aren't any loose wiggly teeth. So next steps after we go through and we go through each tooth and measure any pocketing, we do a polish. So when we use that ultrasonic scaler, it makes tiny little fine lines in these teeth. So the polish is something that's gritty and we'll take those fine lines that we just made and make them super smooth. So final steps in your dental is the doctor will come in, he will look at the dental x-rays that we took. He will also go through and check the probing behind the technician. And then he will extract the teeth after placing a local block in each section that we are going to take a tooth out of. All right, final steps in everything is we will recover your patient in a cage, put them on post-op fluids if the doctor asks, and then we keep an eye on them throughout the rest of the day. Go home times are between 3 and 5 o'clock to make sure that they are awake from anesthesia and ready to go. So that is our behind the scenes in Dental Land.